Hello, hello, everyone. Happy May 7th today. If you're new to my channel, my name is Crystal. I'm a mama of four. I run a full-time daycare and I'm in school full-time to become a counseling therapist. So make sure you subscribe to my channel. I am making quite a bit of videos right now. They were based off of my weight loss journey. I love just sharing real, raw, true struggles and successes with you guys about my journey. That's what made me start my YouTube video years ago, and it's what made me continue to make videos presently. But I do want to switch it up. I want to switch gears a bit. I was just having a discussion with my husband like a week or so ago, saying I don't want to just make my videos anymore based on me talking about my weight loss. I'm gonna hit a point where um I'm gonna have nothing else to talk about. And that's kind of where I'm at right now for my last video of when I did my 60-hour fast. Um, I'm still doing the same thing. I'm still drinking my ketones. I'm still following a low carb diet. I have nothing really new to share with you guys except for I'm losing weight and I'm feeling wonderful. Which you guys already know from my last video. But I want to still keep on. I still want to make videos. I still want to provide information for you guys. So I have made the call to incorporate my counseling therapist learnings, knowledge, all of that. And I want to incorporate into my YouTube videos, whether it be talks about anxiety, depression, bipolar, addictions, you name it. I want to share my information with you. So make sure you guys are all subscribing. Please comment below what you would like to hear from me from um whether you're struggling with something personally, and if you are, please reach out. Or if you know somebody that is struggling with something and you're watching it in front of your face and you don't know what to do and you don't know how to act and you don't know how to approach something, again, write in the comments. I will post a video based on whatever you guys are needing to hear from. So I'm going to start. I thought it was very appropriate considering I post all my videos about weight loss and struggles and successes. I thought it was very appropriate to open the door to this new format of talking about eating disorders. More specifically, today I'm going to talk about binge eating disorder. Hopefully you can hear me over the craziness over there. But as most of you guys know who have watched my videos in the past, know that I am an individual with binge eating disorder. I used to throw out the term all the time that I was a binge eater, but it wasn't until recently, a few months ago, that I went, wow, I actually do have binge eating disorder. When I started learning about it, and it was very eye-opening to me. And it wasn't until I learned what it was, what causes it, and the treatment plans that I was actually able to start breaking out of that cycle. So I think with making videos like this and giving people awareness and education on mental health disorders or addictions or eating disorders, whatever it may be, I think it's so crucial that people know this information. Um, so a quick rundown of my own personal story for the newbies that are watching this channel. When I was a very, very young child, I used to go into the pantry and grab out all the sweet food and all the carbs, and I used to hide it in my room and I would sit there and eat it all. Um, and I never knew why. And then as I started doing some self-reflection a few months ago, I had like this aha moment. And I'm like, wow, um, my parents, though they were wonderful parents, they were never around. They gambled every single night. I was traumatized by my brothers. They used to basically, I was the baby, I was the only girl, and they used to not beat me up, but just like push me around and make fun of me, make fun of my weight, just scare me with things that like would petrify me. The list goes on. And I was seeking food for comfort, which many people with binge eating disorder do. And that is what started it. And because I had no guidance and I had no education and I didn't have someone to correct my behavior, this eating problem carried on through my teens and into my adult life. Um, it became a severe problem. Um, so then a few months ago, and this is where I become very passionate, is a few months ago, I noticed my 9-year-old, she is diagnosed with severe anxiety disorder. She was seeing a counselor, and the counselor a few months ago texted me and said, "Hey, Crystal, we need to close your daughter's account. Um, we feel like she has all the tools and everything that she needs, basically, essentially. Like the wait list here for counseling, hence one of the reasons why I went in this direction of a career, is astronomically long. And so my belief is that they have a long list of children that need in on counseling. And so as soon as they feel like somebody has the tools, they shut them down and they bring in new people. And that's what they did to my daughter. And I was absolutely devastated and upset about this. And that's when I noticed that her behavior changed in a sense of food. And I looked at her and I went, "Oh my God, she is becoming me. That is a mini version of me. The way she's eating, the way she goes into the pantry and grabs out snack after snack after snack. Um, the way she takes her food into her room, like she'll go and like sneak a snack and then she'll go in her room and she'll hide it and she'll eat. Um, she's been hiding in her room a lot more frequently. There's just been a huge shift in behavior, especially when it comes to food, and it scared me, because I don't want her to go through what I did. And all I wanted as a child, or I should say, all I what I needed as a child, is somebody to care, somebody to correct me, someone to give me education, um, on the behaviors that I was making. So I had to sit her down, um, and get curious with somebody. If you're dealing with a child that you suspect might have binge eating disorder, or just not eating, not even just binge eating disorder, but like maybe making unhealthy choices, the last thing you want to do is shame them. And this is why I have done a lot of research into eating disorders, specifically, again, binge eating disorder, as I am somebody that has it. One thing that you do not want to do is shame them or guilt them. I sat down on the couch and instead of shaming and guilting, I got curious and I asked her, "Could you please explain to me? Like, I've noticed lately you have been making a lot of unhealthy choices. And I'm noticing you go to the pantry and grab out a snack and then a few minutes later another one, and I'm finding a lot of wrappers in your room. Could you explain to me what is what is making you make those choices?" And she said, "Well, my lunch isn't filling enough." And I said, "Okay, that's understandable. We should probably look at more ways to make your lunch more filling. Like maybe we should add in some more protein, or let's go to the grocery store and find like some more healthier options that might keep you more full rather than granola bars and fruit snacks." You know? Um, being curious, not shaming her. Everything was going really well. Then my husband came in the room and he had a bag of the night before we had a family movie night, and I had bought like this bag of candy, and I made the girls little um like goodie bags of the candy. And I was in the middle of explaining to my daughter that it's not that we don't get to have these special treats. We just have to be mindful of the special treats and how much of it we're putting into our body. And then I kind of explained to her, like, you know how mom bought a bag of candy yesterday, but we didn't sit on the couch and like sit there and eat it all. I made little goodie bags. Like, that's healthy choices. And that's when my husband walked in with the bag that was essentially all gone because she took it into the room and she basically ate it all when we all went to bed. And he shamed her and he guilted her. And her hands went up to her face and she started to cry and she completely shut down. Um, don't make that mistake. Get like you are there to protect your children and to help them make healthy choices throughout their life. And the last thing that I would have wanted is, I know even as an adult, when somebody, like if my husband were to be like, you're gonna have a piece of cake, it makes me feel like the sense of like I did something bad. And it makes me feel I don't even have like words to describe. It is okay to have cake. It is okay to have cookie or a pudding. It's about portion sizes and being healthy with it. Um, so let's actually get into binge eating disorder, the causes and the treatment plan. I have beside me, I have wrote down notes. I think that it's going to help me keep on track a little bit. So if you notice my eyes kind of shifting, I am reading my notes. So what is binge eating disorder? Binge eating disorder is when you're having episodes of eating a large amount of food in a short amount of time that would not be that would be like a definitely a larger amount of food than what a typical person might eat in that time period. It's kind of it's kind of a sign. Additionally, binge eating disorder episodes are associated with three or more of the following. So, eating much more rapidly than normal, eating until you're uncomfortably full, eating large amount of food when you're not hungry, you're just seeking it, you're just like looking for it and grabbing it because you just want it, eating alone because of embarrassment about how much you eat, and feeling disgusted with yourself, depressed or guilty after you eat. If you have three or more of those characteristics, I highly suggest that you go talk to your medical practitioner, your counselor, your psychiatrist, and talk to somebody about your symptoms um to make a real diagnosis. I'm not a doctor. I cannot diagnose, but I can give information. The frequency, what they say in the DSM-5 is um binge eating episodes typically happen once a week, excuse me, for 3 months. So if you're having one of those episodes once a week for 3 months, there is a chance that you may have binge eating disorder. Um, what are the complications with binge eating disorder? Well, it goes without saying that binge eating disorder can cause significant distress and lead to various health complications, including obesity and diabetes and cardiovascular um, problems. So it's something you most definitely want to get under control before it gets too bad. What are the causes? Well, there's several different types of causes. I know for myself, it was an emotional thing. Um, it started from seeking comfort. And because I didn't have anybody there to correct me or give me guidance, it just continued on in my life. But here are some um suggested, I guess, it's a combination. It could be genetic and biological, environmental, psychological, and social factors that can help contribute to developing binge eating disorder. So let's get into it. It tends to run in families. So if you have someone in your family um who has suffered from eating disorder, whatever it may be, anorexia, bulimic, binge eating disorder, you are at a higher risk of developing it. Um, Abnormalities in the brain chemistry, neurotransmitter imbalances may play a role in binge eating disorder. If you guys know anything about serotonin and dopamine, those can be contributing factors. Things such as low self esteem, body dissatisfaction, um, and difficulty coping with stress and emotions can also contribute to developing binge eating disorder, as well as traumatic experiences such as childhood trauma and abuse. It doesn't necessarily mean that you needed to be beaten, but neglected or felt lost or hopeless. These different types of things can help contribute to developing binge eating disorder. Um, Society pressure to attain certain body images, diet culture, and exposure to certain foods, these also can help contribute. Chronic dieting and weight cycling, such as yo-yo dieting, have been linked to increase developing binge eating disorders. So this is kind of where I see it is when I go on these diets, which I have in the past, right now I don't consider myself on a diet. I just consider myself following low carb, more healthy, more balanced foods, while drinking my ketones because we all know I love my ketone drinks. Um, but when I used to go in on extreme diets or diet medications, you would see my videos on YouTube, they would spike and I would make them. And then, when I fallen off the wagon because my videos would then stop for several months until I was ready to go back on it, and then I go, and it was the yo-yo effect. It made my binge eating disorder way worse because I would restrict myself so much, and then as soon as I had that one day of a cheat day, I felt like I was a failure. And then I just went off the wagon and it got so bad. I needed to have all the carbs, I needed to have all the sugar, all the sweets that I restricted myself from until I felt so guilty and bad that I needed to start another extreme weight loss journey. So this one, particularly for me, hits really close to home, something to watch out for. This is why diets probably aren't the best thing. Lifestyle changes are the best thing. Family dynamics, such as dysfunctional family relationships, parental modeling, or discovered eating behaviors or a history of family conflict may also contribute to binge eating disorder. Um, and something to keep in mind is that binge oh thanks bud binge eating disorder, or really any type of eating disorder, often occurs with other health disorders such as depression, anxiety, and substance abuse. So keep that in mind, um, that they can go hand in hand together. Um, let's talk about treatment. So binge eating disorder typically involves a comprehensive approach that addresses the physical, emotional, and behavioral aspects of the disorder. There is a there are so many different types of therapies, but let's get into a few of them. I highly suggest if you do have an eating disorder, binge eating disorder, that you find a therapist that specializes in CBD or CBT, which is um, cognitive behavioral therapy, um, or DBT. Um, so I'm just looking at my notes here. So with CBT, cognitive behavioral therapy, it focuses on identifying and challenging dysfunctional thoughts and beliefs about food, body image, and eating behaviors. CBT can also help individuals develop coping skills to manage emotions and reduce binge eating episodes. So for somebody that may be an emotional eater, a stress eater, CBT is going to be super beneficial for you. Um, there's also mindfulness practices to help individuals regulate emotions, tolerate stress, and improve interpersonal relationships. Again, just trying to find therapists that are either specialized in eating disorders, which I'm feeling really passionate about, um, or somebody that has the background of CBT would be really, really beneficial. You can use medications as well. Certain types of antidepressants may be prescribed to help reduce binge eating episodes and improve mood. There are other types of medications, but again, speak to your healthcare provider on what would be best for you. Sometimes you need a combination of uh, different things. Nutritional counseling, such as working with a registered dietitian or nutritionist, can help individuals develop a balanced and healthy approach to eating. Nutritional counseling may involve meal planning, education about portion sizes and food choices, and strategies for managing cravings and hunger cues. Somebody with binge eating disorder, just they don't have that, right? They when they crave something, and they don't know what a hunger cue is. They just eat. um Joining support groups or participating in group therapy sessions with others who have binge eating disorder can provide validation, encouragement, and a sense of community. Support groups may be led by mental health professionals or peer fed. So, for an example, even if you don't want to go out into an actual therapy group in person, search Facebook. Um, Facebook has community groups out there that people who are suffering with different types of mental health disorders or eating disorders, they have a group for everything. And if you want something that's a little bit more small and you want to form it yourself, make your own group. But support groups, very beneficial. Lifestyle changes, such as incorporating regular physical activity, making sure you're getting enough sleep. This is key. Stress management techniques and avoiding restrictive diets can help reduce the risk of binge eating episodes and improve overall well being. Mindful eating practices, like learning and practicing mindfulness techniques such as mindful eating, can help individuals become more aware of their eating patterns, hunger and fullness cues, and emotional triggers, and for binge eating. Um, Self-help strategies such as keeping a food diary, identifying triggers for binge eating, developing alternative coping skills, and setting realistic goals can supplement formal treatment and support ongoing recovery. Um, this one I know for me has been a huge help. So I use a program on my phone. It's an app. It's called MyFitnessPal. You can get a free version or you can get the paid premium version. I for myself I pay like 26 bucks a month, I think, for the premium, because I follow macros. I don't think on the free one that you can follow macros. Um, but I know for myself, if I don't track my food, I will overeat. I need to be mindful in like looking at like, okay, well, you only have like 6 net carbs left. So do you really want to have that, or you're going to go over? So it's not highly, I wouldn't classify, I don't classify it as a diet. It's just being more mindful about like, okay, well, that has a lot of carb, and it doesn't have to be so much about net carbs. Let's say you're doing this calorie, you're just trying to um uh have a restriction to your calories. Um, I could look and be like, I have 500 calories left. I'm hungry. I could have a big salad, or I can go to McDonald's and be over. It's just about like it's putting the picture to it and being like, okay, let's make a healthy choice. The journal food diary has completely helped me, and I like I said, I know when I don't use it, it's game over for me. I know that probably I will hit a spot where I can just pay attention and focus on the hunger cues and not have to do it. But I think when you're first starting out, being mindful of what you're actually putting in your body and looking at the back of a package and being like, wow. But something you need to be careful with is that you don't turn your binge eating disorder into anorexia or bulimia. Um, because yeah, you don't want to switch it. You don't want to go from one eating disorder to the next eating disorder. So just be mindful of what we're putting in our body. It's huge. And just getting to know your hunger cues when you're actually hungry. And if you're feeling hungry but you just ate like an hour ago, slam back some water. Honestly, water is huge. Water helps keep you full. A lot of the times, what I'm trying to explain to my kids is sometimes when you're feeling hungry, you're actually just thirsty. So try drinking some water. Drink a big bottle of water before you have a meal. It will also help keep fill up your stomach a bit so you limit your food intake. Um, and just a disclaimer before I finish this video, it is important if you feel like you might have binge eating disorder or you have been diagnosed that you work closely with a qualified mental health professional um, to develop a personalized treatment plan that addresses your unique needs and circumstances. Not everyone's the same. What's going to work for me might not work for you. Um, and treatment might involve, like I said, a combination of different approaches. Some might be just completely fine on just doing some therapy with a counselor or nutritionist. Some might need that extra help with a medication. Everybody's different. So speak to your mental health professional to find what treatment plan is going to work for you. And don't give up on yourself if the first thing doesn't work. Try something different. Binge eating disorder, all eating disorders are treatable. It's about changing that mindset. So please, again, make sure you subscribe, make sure you comment if you have any questions. Let me know what you would like to see next. What you would like me to discuss in the next video, whether it be anxiety, bipolar 2, family dysfunctions, family therapy, you name it, I gotcha. Bye for now.